Like my rose? It's pretty, isn't it? We'll be talking about this rose today. This is Your Menopause Your Way, an education that teaches you everything you need to know in order to make the rest of your life the best of your life. I'm Menopause Taylor, your teacher. In the last 13 videos, we have been discussing cervical cancer, and you've learned all about how it starts, how it progresses, and how it's treated. Now we're at the point of assessing the impact it has on your menopause management. So this is video number 353, and the reason it's important for you to watch it is because I don't cover cervical cancer in my book. I do cover endometrial uterine cancer, which was the unit before this one, but I don't cover cervical cancer. So if you want to know how having had cervical cancer affects your menopause management, this video is the only place you're going to find it. You know, it's interesting to notice the things to which women pay attention versus those that completely escape them. And sometimes a woman assumes that history of having a disease has no effect on her menopause or menopause management when, in fact, it has great bearing on it. Other times, a woman assumes that having had a disease limits her menopause management options when, in fact, it has no bearing on it at all. So I like to explain the impact or lack thereof for every disease process I present. I think this whole tendency to misinterpret the impact of a disease on your menopause management options is a lot like a rose in a couple of ways. We all tend to think roses are beautiful, but it all depends on how you view the rose. You could view this rose and focus only on the beautiful blossoming flower. If so, the rose is really beautiful. Or you can view this rose and focus on the thorns. If so, you might fail to even notice the beauty of the rose and see it as nothing more than a thorny thread. So, roses have thorns, and thorns have roses. You just have to accept that they exist together, all on the same stem. So, for our discussion today, the beautiful rose represents the fact that you are alive to experience menopause. The thorns represent your history of cervical cancer. In the unit on endometrial uterine cancer, I presented a similar video. It was video number 339 on menopause management after endometrial uterine cancer. And in that video, you learned that once you've treated and cured endometrial uterine cancer, you are free to do as you please for your menopause management. You can use HRT or whatever else you prefer. You are Lady Liberty. Well, today, our prop is not Lady Liberty. Instead, it's a rose. In video 339, you learned that even though estrogen definitely causes endometrial uterine cancer, treatment will most likely entail total hysterectomy. And total hysterectomy will remove the glandular cells that respond to estrogen, right here, that were the very source of the cancer. And once they're gone, they cannot respond to estrogen and transform into cancer cells. So that's why it works. So after treatment for endometrial uterine cancer, you are free to do as you please with regard to your menopause management. Well, here we are, talking now about cervical cancer. Do you think it's the same situation? Now, before you blurt out something impulsively, let's review to decipher the logic. And we'll divide our analysis into 4 different parts. The first will be anatomy. The second will be infection with HPV. The third will be cervical dysplasia or pre-cancer. And the fourth will be cervical cancer itself. Do you see how much of a nerd I am? I'm systematic about everything. My goal is for you to always understand the logic. So let's address these 4 things in turn. Starting with anatomy. In video number 342, you learned that cervical cancer begins at the transformation zone in your cervix. That's where the squamous skin cells of your cervix meet the columnar glandular cells of your uterine lining. But which of these 2 cells is the one that becomes cancerous to cause cervical cancer? It's the skin cells. And the skin cells, also called epithelial or squamous cells, do not respond to hormones at all. So, don't dissect a rose. Cervical cancer never had anything to do with your hormones in the first place. So why would anything having to do with hormones matter after you've treated your cervical cancer? It wouldn't. So from the standpoint of anatomy, since the cells that become cervical cancer have nothing at all to do with hormones, they have no impact on your menopause management. The squamous cells are but a thorn that you can ignore. Our second analysis pertains to infection with the HPV virus itself. In video number 346, you discovered that cervical cancer is caused by the human papillomavirus. So the question becomes, how does infection with the human papillomavirus interact with hormones? In other words, did your previous infection with HPV change your body's ability to tolerate estrogen and progestogen? Or did your previous infection with HPV change your benefits or risks of taking HRT? The answer is no for both of these. Having had HPV changes nothing at all about your hormones or hormone replacement. And the HPV virus has no impact whatsoever on your menopause management. So don't dissect a rose. Of course, none of us would think of HPV as a rose, but insofar as your menopause management is concerned, the fact that cervical cancer is caused by a virus imposes no limitations. So despite infection with the HPV virus, you can manage your menopause any way you please, with HRT, without HRT, or any other way you prefer. Your HPV infection was but a thorn that does not detract from the beauty of the rose. The third analysis pertains to cervical pre-cancer or dysplasia. In that case, the abnormal cells only exhibited dysplasia and never became cancerous. If you had cervical pre-cancer, you still probably have your cervix and uterus. And that's because the treatments for cervical dysplasia include freezing your cervix, lasering your cervix, or excising a cone-shaped piece out of your cervix. I taught you about all those treatments in video number 350. None of those treatments change anything about the cells that respond to hormones. The treatment of the precancerous dysplastic cells took place here. And the cells that respond to hormones are here. They do not limit your option of using hormone replacement therapy. So in that case, you can still do as you please for your menopause management. Don't dissect a rose. There is absolutely nothing about having had cervical dysplasia that changes your options for menopause management. Having to endure treatment for cervical dysplasia was but a thorn that did not change the beauty of the rose. The fourth analysis is cervical cancer itself. So what if you had cervical cancer? Do you think that changes your options? Recall in video 350 that the very earliest stage of cervical cancer is treated with radical hysterectomy. That entails removing all your reproductive organs along with some surrounding tissue and some lymph nodes. Do you think that alters your ability to manage your menopause as you please? Let's see. Removal of your cervix erases your risk of cervical cancer as long as it hasn't spread beyond your cervix. Removal of your uterus erases your risk of endometrial uterine cancer completely. Removal of your fallopian tubes and ovaries erases your risk of ovarian and fallopian tube cancers by 90%. And removal of your ovaries also reduces your risk of breast cancer by 50%. So even though you had cervical cancer, a radical hysterectomy reduces your risks for a lot of other cancers. This means that there is nothing about having had cervical cancer that interferes with any aspect of using HRT for your menopause management if you so choose. Don't dissect a rose. So you still have all options available to you for managing your menopause. A radical hysterectomy is definitely a great big thorn, but you survived, and that's the rose. Now, you may wonder why I chose to use a rose for a prop today. Well, it's because oftentimes people extrapolate. They create a problem where there is none. And I see this a lot with menopause management. There's a lot of overkill occurring these days. When I say don't dissect a rose, I mean don't create a problem when there is none. And in the case of having had cervical cancer, there is no impact on your menopause management. Because there is so much fear of HRT, people, both patients and doctors, tend to cite all sorts of things as reasons you should not take HRT. Very few of them are accurate. There are definitely some situations in which the risks of taking HRT outweigh the benefits, but the vast majority of reasons cited by both patients and doctors are extrapolations. And I think the quote, "Don't dissect a rose," captures that. So while nobody should be glad she had cervical cancer, you don't have to punish yourself further with regard to your menopause management. You may do as you please. And perception is everything. You can complain that roses have thorns, or you can rejoice that thorns have roses. Your cervical cancer was the thorn. Your menopause management options are the rose. So, this video was short and sweet and rosy. And next week we'll have the last video on the cervical cancer unit. You are just learning so much. And I hope you can see how it all makes sense. If you're watching all my videos in order, it definitely makes sense. And if you aren't, who knows what kind of confusion is brewing in your head. If you need me to help you personally with anything, just schedule a consultation with me at menopausetailor.me, and please subscribe to my newsletter and to this YouTube channel. Follow me on Facebook, Twitter, Pinterest, and Instagram.